Hi, it's Jessica DaMassa, and I'm here at Frontiers Health. And joining me right now, I have Stefania. Why don't you introduce yourself for everybody watching?
Hi, I'm Stefania Marcoli. I'm a healthcare practice lead for Europe for Frog Design, a design and strategy firm. We essentially use human-centered design to help clients in designing better products.
I understand that Frog's been in healthcare for a long time.
Yeah.
And so talk to me a little bit about how you're trying to integrate human-centered design into the healthcare process, because obviously it needs some help.
You know that doctors care about patients, so it's really about looking at the patient not only as patients but as human. So the main point is we work with different stakeholders, with pharma, insurances, different parties in the healthcare ecosystem to look at the patient needs, first of all. And the project starts always with doing qualitative research and understanding the perspective of users.
What's one thing that you would advise healthcare companies, either big ones or startups, to do in terms of integrating design thinking more into their solutions?
I love what the CEO of Proteus said, to design product that makes sense for people needs. So look at the perspective of the user, and not as a customer, but as a user.
Is there anything that you feel that is a common mistake that healthcare companies make when it does come to human-centered design?
I think it's difficult to keep the lens of the different stakeholders. It's easy to jump to your conclusion and look at your business interest, while we see now how much the business is changing. So you don't have to change to start from your lens or your current business value, but be more open.
And a lot of people will say that good design costs more money, or it costs more money, or it takes more time to pool together all the stakeholders and have a conversation. How would you argue against that?
Well, I think good design, it's about the impact that you want to have on people behaviors. If you see how much is now talking about digital therapeutics, as it's just about the impact on people's life. So I would ask back, what's the impact that you want to have on people, and then discuss about the value.
What does good design in healthcare look like?
It's a person that is curious. It's a person that enjoys talking with different stakeholders, with pharma, but also with medicals. I collaborate a lot with the medical division in Oxford, and I'm passionate about value-based healthcare as triple value, so not only as Porter, not only the economical perspective, but also the population health side.
What do you mean by people values in terms of values-based healthcare? What do you mean by that?
It's more like, I don't know if you know the triple value model by Murray Gray,
yes.
But it's the personal value that is more the subjective value, and the health value, the health side. So considering also the personal value, if you go and think about PROM, patient-reported measurement, and all that side, that's the part that I think it's important to consider.
Very good. Stefania, it was so nice to talk to you.
Yep.
Thank you so much for stopping by and sharing your perspective. I'm Jessica DaMassa here at Frontiers Health. Thanks for joining us.